Welcome to the second session in the Pulmonary Rehabilitation Education Package. There are 5 topics in total: managing a flare-up, managing breathlessness, mental well-being, benefits of activity, and medication for your lungs. This second session, Managing Breathlessness, helps you to understand how you can manage your breathlessness by suggesting strategies and tips that might help. So how does breathlessness make you feel? This diagram demonstrates how quickly breathlessness can sometimes escalate into a panic. If you are breathless and worried about your breathing, that worry can sometimes make you start to breathe more shallow and quicker. The faster you're breathing, your breathing muscles can begin to tire, making it more effortful to breathe. You therefore become more breathless and become more anxious that you're becoming more breathless. The breathing muscles start to work harder and tire even more, and this continues, this vicious cycle, until you're breathing quite quickly and you're starting to slip into a panic attack. If you are breathless, you can use your blue inhaler to relieve some of the symptoms. This inhaler is often fast acting and should work within 5 to 10 minutes. It's very important to make sure that you use the correct technique when using your inhaler in order to get as much of the dose into your lungs. When using your inhaler, make sure you are sat upright and you are holding the inhaler vertical. Shake it 4 to 5 times. Have a long breath out and then place the inhaler into your mouth with a tight seal from your lips. Start to breathe in slowly and deeply and press the inhaler down. Keep breathing in for about 3 seconds and then hold your breath for 10 seconds. Once you've held your breath, you can exhale slowly. Some people struggle to hold their breath and may have a spacer device that they can use with their inhaler. This is like a chamber and it comes in different shapes and sizes. Again, you need to make sure that you are upright and you have given your inhaler a good shake before connecting it to the spacer. You can press the inhaler into the spacer and breathe in 5 normal breaths, making sure you have a good seal around your spacer. If you are wanting to take a second puff of your inhaler, you must make sure that you give it another good shake before you take it. Some of the side effects of using the blue inhaler might include palpitations or a sensation that your heart is racing and shaking hands. This is if you are to use your inhaler quite a lot throughout the day. If you are feeling quite breathless, you can use your inhaler up to 10 times, making sure that you shake between each breath. It's also helpful to use your inhaler, your reliever, to open up your airways before doing any activity. So before you start your pulmonary rehab exercises, maybe use your inhaler to enable you to be active more. Another technique that can help you to manage your breathlessness is to use certain positions. Leaning forwards helps with breathlessness. As you lean forward, your stomach will fall forwards, and this allows room for the diaphragm and the lungs to expand. Alongside leaning forwards, if you're able to rest or fix your arms on something, so a windowsill or leaning on the back of a chair or a table, this allows your shoulders to stabilise and allows the muscles to work differently to move the ribs. This will also allow the lungs to expand and help with the air moving into your chest. You may find that when you go shopping, your breathing is much easier if you're pushing the trolley. This is because you're in that forward leaning position with your arms leaning over the trolley. Some people choose to have a walking aid, such as a frame, when they're out walking, again to encourage this forward lean and this fixing of the upper limbs. There has been a lot of research which has shown that air movement around your nose and your mouth can help to relieve breathlessness. For this reason, people often find that opening a window or standing near a fan may help to reduce that breathlessness. If you can have a portable handheld fan, then when you're out and about, you can use that to help to relieve any of your symptoms of shortness of breath. Opening a window or standing by a back door may help. Make sure that you are drinking plenty, because when you breathe through your mouth, which happens when people are puffed, then this can make your mouth quite dry, and this can dry out any secretions on your lungs. So take a sip of a drink when you are feeling a bit breathless and working a bit harder to breathe. Try not to drink too much coffee either, as this dehydrates you, and also caffeine can increase anxiety and make you a bit more breathless. Let's talk about the diaphragm. So the diaphragm is the main breathing muscle which lies underneath your lungs. At rest, the diaphragm is domed, and when we take the breath in, that diaphragm flattens out, allowing the lungs to expand downwards into that space. The diaphragm is the main muscle that we should use, but sometimes some people use the muscles around the shoulder and the neck to help with breathing. These are often referred to as the accessory muscles. There are some breathing exercises that can help when you're breathless. One of them is called pursed lip breathing. This is where you blow out like you're gently blowing up a balloon. When you breathe like this, it helps to open some of the smaller airways in your lungs and keep them open. Another technique is what we call breathing control, and that's illustrated in the diagram of the lady lying down. Breathing is more efficient and effective when you use your diaphragm. As you breathe, your stomach will rise when the lungs fill, and then the stomach will fall as the air leaves the lungs. When you use the muscles in your neck and your shoulder, that can get quite tiring, as these accessory muscles are quite small muscles and it's a lot of effort for them to lift the ribs up. Whereas using your diaphragm and breathing from the lower parts is less stressful and more relaxing. It's good to practice using your diaphragm muscles when you breathe. You can do this by lying down supported on some pillows, and if you place your hands on your belly just above your belly button underneath your rib cage, then you should feel that your belly rises as you inhale and falls as you exhale. Lying down is the easiest position to practice this breathing in, as you are relaxed. Another technique or a breathing tip to use if you're feeling breathless is what we call rectangle breathing. It's helpful to make your breath out slightly longer than your breath in. The more air you breathe out, the more your lungs will want to spring open and fill with air. The rectangle breathing allows for a short breath in, a longer breath out, and then a short breath in again up the other side. It's a useful tip to use when you feel your breathlessness is starting to get a bit out of control and you're starting to panic. When you breathe more regular and in like a rectangular pattern, this will help to slow down your breathing rate. By slowing it down, you can get more oxygen into your blood, and more waste gas out. It also helps with relaxation. There are some things that makes your breathlessness worse. One of them is overthinking. If you focus too much on your breathing, then that can make a person anxious or start to panic. If you're feeling quite breathless, as well as using some of these tips, sometimes a distraction can help. Turning on a TV programme or a radio station that you like. Or maybe trying some hobbies such as crafting or colouring in or puzzles. Keeping busy keeps the focus away from the breathlessness. If you do think that you're quite an anxious person and you do worry, then maybe speaking to your GP about some therapy to help with this, either talking therapy or there are medications which can help to reduce anxiety and panic attacks. Another thing that can make the sensation of breathlessness worse is when you avoid activity. If you avoid activity, then you become deconditioned. In order to do activity, your muscles need oxygen to work. If you're deconditioned, then when you try to do a function or an action, your lungs can't work fast enough to get the oxygen to the muscles. The muscles then become more deconditioned. The only way to try and avoid this cycle is to do some regular activity or regular functions or tasks. Little and often will help to strengthen those muscles and strengthen the lung muscles. Although it might seem strange that breathing can make your breathlessness worse, what we mean by that is when you use the wrong muscles to breathe. We've talked about using your diaphragm and how that is one of the best muscles for getting air to the biggest parts of your lungs. Some people tend to use their neck or their shoulder muscles more. This will cause shorter, shallow breaths. If you're breathing more shallow, that might increase the sensation of breathlessness or that you can't get enough air in. So using your diaphragm is the best way to breathe. If you can practice using your diaphragm and doing the breathing control technique as discussed on the previous slide when you're well and relaxed, then that will become more familiar with you. Other things that won't help breathlessness is a large meal. Your stomach sits underneath your diaphragm. If you have a full stomach, that makes it harder for that diaphragm to flatten and the lungs to expand. So if you think having 6 small meals or little and often is much better for your breathing than having 3 large meals. Another misconception is that oxygen will help breathlessness. It does not relieve breathlessness. It's used in very specific cases when people have had their bloods tested to check how much oxygen is in the blood. Some people have a problem getting oxygen into the blood and they may need supplementary oxygen to help. If you're short of breath, oxygen will not always help. If I was to run round the block, I would be breathless and I would be panting, but my blood levels taken on my finger would reveal that I have enough oxygen in my body. When you have your blood oxygen levels taken on a finger probe and your oxygen levels are normal, then you have enough oxygen in your body, and using some of the tips discussed earlier will try and help to relieve that breathlessness. We hope you have found some useful tips in this presentation on managing breathlessness, such as pursed lip breathing and that forward leaning or breathing in a rectangle. Our next topic, session 3, is on mental well-being, and we hope that you'll join us for that. Bye bye.